Statistics show more than 160,000 U.S. children underwent cosmetic surgery in 2008. These days, more and more youngsters are going under the knife to get the look they want. Cosmetic surgeon Dr. McIntyre Bridges with Bridges to Beauty joins us to talk more about common corrective operations in children and also teens. He's going to be answering your questions for the next half hour, so we really want to encourage you to ask the questions on your mind. If you're online at KTBS.com, just scroll down, click on that orange Healthline 3 box on the right side of your screen. That takes you to this webcast, which is streaming live. Take part in the webcast right there. You can also submit your questions right there at KTBS.com, or you can give us a call right now, 318-219-4569. We'll be taking your calls and your questions until 12:30 this afternoon. Dr. Bridges, great to see you. Thanks
great to be here, Chris,
for coming in. Now let's kind of talk about teens and also youngsters in cosmetic surgery. What are some of the main procedures that you perform when it comes to youngsters?
Well, in youngsters, you got to remember that most of them, I mean, we call it cosmetic surgery, but most of it is kind of reconstructive.
Okay.
What we're talking about, because you rarely get anybody to get breast implants and stuff. And they're usually their facial features aren't developed enough to do things like rhinoplasties or other features.
Okay.
The most common ones we'll see basically is treatment of gynecomastia, which is enlarged breast in young males, and also otoplasties in both males and females, and that is protruding ears.
Okay.
Other procedures that can take place usually in later teenage years in males, like if they have a small jaw, advancement, things along the lines. But in females, it's usually a bit later because their jaws don't stop growing until like 18. But again, it's mostly gynecomastia as well as protruding ears. And
protruding ears, kind of take me through. This is obviously something you're born with.
Yes.
And so this is something that the kids might get made fun of, and which is a lot of times why they come and have this reconstructive surgery. What goes into this procedure?
Well, what goes into the procedure basically is the fact that there's some malformed cartilage. And let me just back up just a little bit. Okay. If right at birth, it looks like your child has large ears, you can wear a kind of a mold that will help shape that immature cartilage.
Really?
And generally it's worn for a couple weeks or so, and that can help flatten those ears in terms of a correct shape. But moving forward, if that is not done, a protruding ear has generally two components. One is what's called the conchal bowl, which is the part when you're sticking your ear down in your ear canal. Things the rounded portion around it is the conchal bowl, and if that cartilage basically has grown too much away from the mastoid process of the head, it can give you the lower aspect of your ear pushing forward or out. Second component of it is the upper ear. Okay, its protrusion is controlled by the way that upper ear cartilage just folded. If you look up there, there are two folds in most normal ears. One's kind of sharp, and then one's a little bit wavy. If you don't develop there and it's flat and things, it tends to kind of roll forward. So, you can see both. You can have those individually, but most of the time they're in combination. And you're taking out cartilage in the face of in the area of the conchal bowl, and you're reshaping the cartilage in the upper portion of the ear to get them flatter.
Are protruding ears, is that something that's inherited?
It generally tends to be.
Really?
There's a component to that. There sure is. Yeah.
And how long does a procedure like this take?
It takes about an hour and a half.
Oh, so not bad.
Yeah, sometimes a little bit longer. I mean, the more mature the ear, like I'll do adults who want otoplasty. The more mature the ear, it might take a little bit longer because you have to really score this upper portion of the ear to get it to lay flat. Their cartilage is not quite as supple.
Right. I think I always thought protruding ear, it would be something like you would. This sounds silly, but kind of tack it down, kind of thing.
Well, what you want to do is you don't want to get it closer than like a centimeter from what's called the mastoid process, which is that bone back there, because it looks too flat.
Right.
And normal ears aren't flat against the skull. Okay, there's at least a centimeter and a half worth of natural projection. So when you're taking out that cartilage, you're taking out the cartilage first in a reasonable size amount and things, and then you're adjusting, shaving down other cartilages to get it close. I mean, basically,
Right.
it's an eyeball thing. It's an artsy, craftsy kind of situation, and you take out a certain portion. You don't take out all you expect to, and then you shave it down until you get the correct proportions.
And you said about an hour and a half, 2 hours
Yes.
is the time it takes for a procedure
Right.
to perform this
Yeah.
procedure. How about the pain for it?
Well, I normally say that head and neck surgery is more of a nuisance discomfort.
Right.
Ears is a little bit more.
Is it? I don't think so.
Of the areas of the face, like faceless, it's a nuisance discomfort. It really doesn't bother people. Eyelids, their biggest nuisance is they swell. They really aren't that uncomfortable. Ears tends to be more uncomfortable. Although we give pain medications, I don't get called for pain medications because of ears. We have to wrap them up when we get through, kind of like a little mummy.
Right.
They do feel a lot of relief when that comes off, but you put a reasonable amount of pressure on it because you can have some bleeding behind the ears that it's a nuisance. It would be okay, but it slows the healing a bit behind the ear.
Recovery time, a week, couple of weeks, or?
Yeah, as far as getting that bandage off,
Right.
after a couple of days and stuff, the soreness really isn't there. I do have them wear some type of protection for at least 2 months afterwards, 2 months, 6 months 6 weeks to 2 months, and what that, especially in adults and kids, you want to wear a little headband or, when I was young and things, I used to have a crew cut, so we'd put the stuff in there and then have to wear this little pantyhose thing on your head. Cutting pantyhose and stuff there, and putting it over there because you want to keep the ears kind of down. You don't want them to rub against the pillow and things and pull stuff apart. The sutures that you use for this are strong. It's just that your cartilage isn't strong. Mm-hmm. It's like you can get wire and pass it through a bar of soap just by pushing. Okay, your cartilage is a little bit stronger than a bar of soap, but it's brittle. Number one, and number two, you can pass. You can pull that stitch through that cartilage, and so protection is real important, especially in kids. If they're on the playground stuff, they shouldn't be really, tussling it at all. In fact, during the day, if they need to, they can wear a little headband. At night, again, same thing.
Right. We were talking earlier over on KTBS-3 that around age 6 is when you perform some of these, or is it more like in the teenage years?
Most of them are in the teenage years because
okay.
they finally gotten tired of it. The reason I brought up the age 6 is when we do ear reconstruction, if they don't have an ear, or if they have, really malformed ears and you want to do cartilage grafts or other type of procedures to reconstruct it, you don't want to do it prior to age 6 because their ears haven't finished growing. I mean, 90% of the growth of your ears will be at, age 6.
Okay.
Also, if you can catch them a little bit, if they're 6-year-old and they haven't gotten into school yet, and things, it's probably better from a psychological standpoint of view because they get less teasing.
So you mentioned as far as right when a child's born, if you notice that they have protruding ears,
Mm-hmm.
there's an actual helmet. Is that something that your doctor would kind of suggest to you, or that you would have to ask your doctor about?
I would think most pediatricians would see that,
Okay.
and maybe recommend it. And what happens is, like the physical therapy or rehab therapy, people come up and they, just like if you're going to do, dentures for teeth, they get a mold and stuff like that, and they do mold the ear, and then they make it kind of a soft thing, but it's a little helmet thing they wear, a little headband they wear over the ears. And again, the value to it is that it's kind of like you ever see those locusts that come up, those 7-year locusts and things, when they come out they're all pink and stuff, and they just they're all wet and their wings haven't matured.
Right.
Okay, but over the course of several hours stuff, their wings start to mature. If it takes several days for that cartilage to mature. Okay, and if you can mold it prior to that, I think that's a good thing to try to do.
Right.
After a week or so, it's probably not relevant.
Okay.
Yeah.
Interesting. If you have questions for Dr. Bridges, we invite you to give us a call, 318-219-4569. You're also saying enlarged breast in boys is another common procedure that you perform. Kind of take us through this procedure.
Well, that procedure usually involves, making an incision in the lower portions, around the lower portion of the nipple, the round portion, and then, going there and taking the breast tissue out. You would think that basically just by looking at it, especially if they're a little bit overweight, that it's all fat. And it really isn't. There's usually very little fat in kids or teenagers that make up their breast tissue. It is breast tissue by itself. And breast tissue, as an analogy, is more like what I call gristle in a steak. I mean, you can try to liposuction that to death and things, and it isn't going to come out. It might flatten a little bit, but it certainly does not. You don't get much benefit from it.
Okay.
In older people, like men, I have some men come in that in their 30s and 40s, and sometimes even later than that. You can get by with liposuction about half of those.
Okay.
You can tell when you go to do the exam which ones have a little bit more density to it. That means they have more breast tissue, in other words, gristle. If you try to liposuction that and things, again, you're not going to get a great deal of value from it.
So as far as how do you know if your child is just overweight and that's part of what the enlarged breast in boys, or if it's actually a problem?
Actually, if it looks like a breast and stuff, it's a problem.
Okay.
Yeah, they can even lose weight and things, and it might get smaller, but it's protrusion is not going to go away because it's breast tissue. Breast tissue doesn't respond to diet. The fatty tissue in that skin envelope we call the breast and stuff will, but the actual breast tissue will not. It doesn't change over time.
Interesting.
Hormonal issues associated with gynecomastia, you have to kind of check those out. I mean, usually the pediatrician will look at the child and things. If he has other issues, they'll do a panel for him. Hormones, but it's a common problem. But hormone-related gynecomastia and things is exceedingly uncommon.
Okay.
So usually they, half the ones they get haven't had a hormone thing because they really didn't need it because they don't have other issues like renal problems and things like that. And so doing that operation is very, very helpful for them.
So is this something that's more common in teens than in youngsters?
Yes.
This procedure?
Yes. I mean, what will happen is, it might be recognized as early as age 6 or in the single digits. The pediatrician usually, recommends them waiting until, 16. I've done them, 12 years old and above. The weight, I'm not sure how effective that advice is. Most of them tell me, haven't seen any change for since he was 10 years old.
Right.
But it's a belief that maybe the hormones, when males go through puberty and things, they have more testosterone. Testosterone doesn't cause gynecomastia to get bigger. Men and women do have estrogens, okay, but normal estrogens in a young male and things is they're probably more sensitive to it. But it's most pediatricians will tell them to wait till 16. I think you can do it before that because
Really?
I've never seen them go away.
And how long does this procedure take?
Now it takes about an hour and a half.
Okay, so about the same as the
Yeah,
other.
and there's certain things we have to do afterwards. I have to put a little drain in underneath the skin and into that cavity I took out because I'm taking out probably a chunk about this big. It's about that thick in most of the young men I see. You don't want a fluid collection in there, although it's real common. Okay, putting the drain in, wrapping them with an ACE wrap to kind of get that stuck back down to the muscles as quickly as we can, and things is the object of that. You just take the drain out in about 5 days. About 30% of them will collect fluid anyway, but you can tap that off in the office because it's generally kind of numb because where you've done the surgery, the skin on top stays numb for a while.
Really? Are there any pros or cons to getting this a little bit earlier rather than waiting, say, until your college years or so?
The primary motivation, the advantage of getting it at all is that there's a stigma associated with it.
You just feel better.
Yes.
Yeah.
Oh yeah, they can wear, they don't have to go on the beach in their t-shirt, okay, and it's just, it's the stigma. I mean, the advantage is, eliminating that stigma earlier in life.
Why corrective surgery for teens or youngsters? Just because of self-esteem?
Self-esteem.
Yeah.
Yeah, that's most of it. Even for jaw advancements, it's a image issue.
Okay.
I mean, it's not making them swallow any better or talk any better. If they have cleft lip palate, sure, you're going to close that because you need that palate to develop normal speech. We do some nasal reconstruction and cleft lips, they always have a fairly characteristic look to their nose. They need more reconstruction for that nose than, say, a common rhinoplasty.
You mentioned earlier that another common procedure was the jaw. Is it kind of the jaw sticks out, or what is
Usually
that common?
it can be both.
Okay.
Probably most common is retruting jaw,
Okay.
a small jaw compared to the
Okay.
upper jaw. It just, if you move that forward and get a stronger chin, it just looks better. Also, it helps correct some dental issues. Usually, you want your bottom jaw and your upper jaw dentally to line up, so that when you bite or chew and things like that, there's pressure against both of them. If you have certain ones that don't have pressure to it, they tend to kind of overgrow as far as their length, and then that can cause other problems in terms of just hygiene as well as bite issues.
It can kind of lead, like you mentioned, to
Yeah,
other
they'll get
problems.
TMJ or something like that.
Really. And are these procedures safe? We talked about the protruding ear, the breast, enlarged breast, and the jaw. Are all three of these procedures safe?
Yes. No, the jaw is a little more extensive.
Okay.
They generally have to wire, teeth or put some type of retainer just as it heals, because you just advanced those bones. You put little screws across there or some type of device to hold it. It takes a while for that to solidify, and so its ability to kind of drop back. In fact, they do drop back a little bit. You actually kind of during the operation kind of overcorrect a bit, because you expect a couple millimeters worth of drop back, if not more. But it's a more complicated procedure, and it requires the hospitalization, whereas the other two don't require hospitalization.
So obviously longer recovery time, more hospital time.
Right,
kind of
right.
thing.
And the reason for the jaw and the post-operative follow-up and being in the hospital is more airway issues.
Okay.
You're working the mouth and things. The airway, you can have some swelling.
Right.
It's safe, but that's the reason you do that. You don't want to put somebody in jeopardy, even though it might be very uncommon for that to happen.
Is cleft palate, is that a procedure that you work on often as well?
I don't do it very often.
Really?
Yes, I don't do it very often. But I used to do it a lot. I was trained in.
And for folks who don't know, cleft palate is?
It's actually a split in the palate. Okay, then you can have a cleft lip, which is a split in the lip, and you can have a combination of both. It's a developmental problem where basically the lips and the jaws didn't fuse together. You actually have like three segments that create your lips and your palate region. This portion here is during development is totally separate than these two components, and these two components grow together to this little portion here.
Okay.
The nerve innervation is actually different to them too. Cleft palates, real important to fix, kind of early on. It'll help actually guide a palate, closer together. Some palates are kind of wide apart, okay? And if they have a cleft lip too, you can bring that lip in and just getting it restored and things. There's enough pressure to slowly move those palates, those bones together in kids. So there's usually a timing issue in when you will do, a cleft lip, and then when you would do a cleft palate.
And recovery time for that, I'm sure a little bit longer.
It's a little bit longer. For the lip, it's soft tissue. It doesn't have anything to do with bone. The palate, you have to do an undermining of lots of tissue to bring the palates together. You're not really bringing bone together. Okay, you're bringing the soft palate together. But once it's sealed and stuff, it's perfectly functional. It generally extends back into where the uvula is, the soft palate. And again, you're doing that because speech, primarily. Swallowing is an issue, but even kids with cleft palates can, suck on a bottle, things along those lines. They'll get some regurgitation to the nasal region, but that's usually not as big of an issue.
But you mentioned you like to do these surgeries earlier on. I mean, are we talking about babies? Are we talking about toddlers?
Yeah, the cleft lip. Some people do it within the first 3 months, 6 months.
That early?
Yeah, very early. And that's not. It's beneficial from a cosmetic reason, but the reason they do that is if they have a palate that's associated with that, it helps close that gap between the two.
Okay.
The cleft palate, it's kind of individualized. You want to do it, prior to them starting to develop, normal speech, because without that palate, they'll, it'll condition the brain to even if it's closed, to talk in a certain way.
Really? What about, do you have a lot of females or maybe even male youngsters or teens coming in wanting their nose smaller?
A fair number.
Really?
It's a small, it's a single-digit number. You don't want to jump in too early because, again, there's, males, noses grow until they're almost 17 or so. Females, even a little bit longer. And so if you reduce a nose but it continues to grow from a cartilage standpoint of view or even bony standpoint of view, you've kind of jumped the gun. It's not that they'll get that hump back completely, but there will be probably some raising associated with it.
So there's a chance if you get this type of procedure done at a young age that it's not going to stay looking perfect like it was when you actually perform this procedure.
Right. Now for cleft lip nasal deformities. Okay.
Now what's that?
Well, there's characteristic nose features that are associated with cleft lips. There's deformity of what's called the alar cartilages, which basically are these lower cartilages that support the base of this nose, and usually it's kind of collapsed like this, and things. The filter column, the column base is kind of shortened, and their nares can be narrowed too. You want to do those fairly early on. Again, it's not for breathing purposes, but it's for cosmetic purposes, because it tends to kind of be something that would hold them back.
And I mean, obviously, there's certain reasons that these youngsters want their ears fixed, enlarged breasts fixed. But we know it could be a cruel world, especially when you're a youngster and just getting teased and made fun of by your classmates. And so in a lot of cases, that's probably why the parents want to get it taken care of for their kids.
Yeah, it hurts the kids and it hurts the parents.
Right.
I mean, they don't want to see their child upset. I mean, no one wants to see their child upset, but the mothers, will bring them in. The children want it and things. The younger they are, the less interested they are in it. But the parents would probably want it more because
they know what's going to come when they get older too.
Yeah. And it's just an awareness of it. When you're younger, you're actually less aware of it in kids. Like before 5 and things, our awareness of the differences between people is a lot less than as we get older. There's a certain period of time where the brain starts to recognize, oh, he's different looking than I am.
Right.
And so, whereas before we would play with them all the time, but, there's a switch that gets turned on.
Do you guys have different guidelines, obviously, when dealing with children compared to adults when performing cosmetic surgery?
Well, yes. I mean, it really deals, you want to do the health checks and all. We don't need to draw a bunch of blood, for them and things. Usually like a little CBC or even hematocrit will suffice because most kids are healthy. They don't have high blood pressure or kidney problems and things, and so you don't have to send out blood for electrolytes. You still give them pain medication, but you certainly don't need to give them as much as maybe an adult needs.
What about liposuction in high schoolers? Is this something that you see? I've heard about it here and there, but does it actually?
I rarely see it.
Really?
I mean, that's probably more of a West Coast phenomenon.
Okay.
I rarely see one come and asking about that, and it's usually like say anywhere from 20s, mid to late 20s stuff on up. I've seen them younger than that, but I don't know if I'd really do that.
Right.
It's really hard. I mean, their fat is very, very fibrous.
Right.
Even with the smart lipo and things, I mean, it's a slower issue.
Really?
With the regular liposuction, it's like trying to put this cane through a Brillo pad. I mean, they're incredibly fibrous.
And is it because their bodies haven't developed and
it is
fully?
In that age group and even into their 20s, the fibrous tissue there is a sign of youth. As we all get older, I don't care what kind of collagen it is, whether it's joint collagen or we lose collagen in our fat. We just lose collagen.
Right.
Okay? Theirs are useful. They got the hormones,
happens,
and
right?
it just happened. Fortunately for me, but I'm just saying it's one of those issues where they're growing. And collagen is the basis of most of the things that hold our structures together, and it's dense. I mean, it's knocking fat cells out of their collagen is a heck of a lot different than knocking fat cells out of someone who's 30, 40, or 50. Big difference.
What about breast augmentation in high schoolers? Do you see any of that?
Well, people do come in for it. There's a age limit, that you're probably going to have a standard from, and that's 18 and above.
Okay.
The FDA doesn't want you to use silicone gel implants in girls who are not 22 years old. I don't have a good idea why they came up with that. And some people still do. I mean, it's just an FDA recommendation. They won't come into your office and throw you in jail. But they'll come in, and again, they're generally, it's one of the things where they probably got teased a bit and things, and they just don't have anything, and they just like to have more of a balanced shape and form.
Right. Right.
Yeah.
Dr. Bridges, what's your advice to parents out there who have kids that, are maybe getting made fun of, and maybe the parents have thought about, getting this reconstructive surgery for their children? What would you tell these parents?
Well, I would, some of the kids, it's not very many, are just, they don't care. I mean, they're going about their business. They're just one of those great personalities where it doesn't bother them.
Right.
Whereas probably most of them do. And I recommend at least check into it. Have them evaluated, discuss the options associated with it, although there's not a great deal of options associated with it besides leave them alone or do the operation. and then, the risks and benefits. I mean, there's not much risk to either of them. Okay. I mean, the collecting fluid underneath the skin for gynecomastia, it's just one of those nuisance factors that goes along with that surgery. I mean, all surgeries have their nuisance factors. In ears and stuff, it's usually that soreness. Okay, on this, it's not real sore. It really doesn't keep people down per se, but you want to limit their activities because that muscle's moving and that skin's trying to stick down on it and things. So that's a setup for fluid collection.
Right. So I guess to do your research, I'm sure you guys do an appointment before they actually come in to kind of break it down what exactly is going to happen for the patient.
You need to have that discussion and what it will do for their child. Now I've had this experience before where a young man comes in, he's in his mid-20s, he'd saved us his money for his protruding ears, had the surgery done, great result, his mother comes back with him, I think on the second, go round and things for follow-up and things like that, and she was just so mad.
Why?
It wasn't her child.
Really? Because that was her child from day one that had the protruding ears.
Yeah.
And so that was kind of like his characteristic that defined him.
Right. But his characteristic had people make fun of him.
Oh, absolutely.
Yeah. But I was just,
really?
Humans are funny, but,
Wow.
I mean, I've had, at least one mother that was not real happy with the result, even though the great
and
result.
not anything that you did. It was just that she thought that
it was
wasn't.
a great result.
Right.
Yeah, and the son loved it and things. And he's like, say, he's a grown man, he's 22 years old or something like that. And, but she didn't tend to like it. She even said, well, her husband doesn't like it too. I'm not sure about that.
Right. I guarantee you that her son felt better about himself.
Yes.
When he was out and about in public, and, and not having to worry about people making fun of him.
Yeah, or having it covered up. They used to wear long hair to cover things up.
Right.
And so he just decided he wanted to get it done. Like I say, he worked, he saved the money himself. Again, I mean, it was his decision. He's 18 years old. I think he made the right decision.
Right.
It's just that,
And I'm sure as far as prices on these different procedures, the prices kind of vary?
Yeah, they vary, and it's usually based upon, difficulty and time. Okay. I can't quote them right offhand and things what they are because there's a facility fee. I don't know, but at least come and get them checked out.
Yeah, exactly. And even if you're thinking about doing it, it's a good idea just to come stop by.
Sure.
You'll look at the patient and say, "Here's what I would do." Kind of be able to give them a better price estimate as far as this is how long it would take. This is when we could do it. This is how much it would cost.
Right.
And that kind of thing. This is the outcome that you would get.
Absolutely. Yeah.
Good deal. Well, we have about a little over a minute left. Any other common questions you get when it comes to cosmetic or reconstructive surgery in young adults or teens?
Probably like I say, the most common thing is downtime. Okay.
Right.
Both these operations require some diligence of the patient afterwards. Again, protecting those ears because again the tissues there, the ears don't take a joke. They basically, that cartilage it has some substance to it and it's strong. You just don't want to test it. And for the gynecomastia, wearing a compression you know, ace wrap or even compression garment, you know, something that's nice and firm, because
Right.
you have to get that skin stuck back onto that muscle as quickly as you can.
Right,
Okay.
right.
You know, you're just trying to avoid little nuisance factors associated with it.
Got to make sure you do that after the procedure stuff. It's just as
Yes.
important as before the procedure. Dr. Bridges, phone number at your office there.
Yes, 318-218-8555.
Thank you so much, Dr. Bridges. That's going to do it for us.